Welcome everyone to another episode of Dr. Mercola's Cellular Wisdom, the podcast where we explore the health stories shaking our world, then put them under the microscope to see what makes them tick. I'm Ethan Foster. Some call me a watcher of humanity, but I'm not sure I watch as much as I quirk an eyebrow in its general direction.
And I'm Alara Sky. I prefer to think of myself as a perpetual questioner, armed with humor and a fascination for everything from kale smoothies to quantum physics. Today we're tackling a big topic, the fentanyl crisis that's been devastating communities all around us. We'll be peering into the heart of addiction, public health responses, and the complexity of synthetic opioids.
Fentanyl, not exactly the conversation starter you'd bring up at a party if you want to keep the vibe light. But here we are, unraveling the complexities because it's that important. There's a reason Dr. Mercola has been ringing alarm bells on this subject. The crisis is massive.
Indeed, the data is chilling. In 2022, more than 6,300 people died in New York State from opioid overdoses. And the lion's share of those overdoses pointed directly to fentanyl. That's a staggering number. Even more staggering is that across the U.S., it's the leading cause of death for Americans aged 18 to 45. Let that sink in. It surpasses car accidents, cancer, and, in many cases, other prevalent causes of mortality.
It's sobering, but at the same time, you see headlines. Some folks still believe fentanyl is just another opioid, like a slightly stronger version of morphine or heroin. They don't realize how a few grains of salt's worth of this stuff can be fatal.
When we talk about how potent fentanyl is, we're talking about an opioid that's 50 times stronger than heroin. Then there's carfentanil, which is basically the supervillain among supervillains, clocking in at 100 times stronger than fentanyl. I almost picture a toxic balancing scale. On one side, you have the usual suspects, and on the other side, carfentanil tips the scale with dramatic flair.
Most people wouldn't expect to find carfentanil in their local community, yet the data shows it's been popping up in dozens of states, 37 to be exact. Overdose deaths from carfentanil ballooned from 29 in the first half of 2023 to 238 in that same period of 2024. That's not just ballooning. That's like letting a helium tank run amok on your living room floor.
The real kicker is that fentanyl isn't always sold as fentanyl. It's often mixed into other drugs, cocaine, methamphetamine, counterfeit pills. The user might have no idea what they're taking. That's like reaching into a candy jar expecting a mint, only to find out someone slipped in a chili pepper. But instead of a spicy taste, it's a life or death roulette.
That's the part that unnerves people. If something is labeled or sold as one thing, but it's actually laced with fentanyl, how could a person possibly protect themselves? It's a total blind spot.
And then there's naloxone, also known as Narcan. It can reverse an overdose if administered in time. But with fentanyl's potency, first responders might need multiple doses to bring someone back from the brink. Imagine a fire extinguisher designed for a kitchen grease fire suddenly going up against a 3-alarm inferno. The gear just isn't always enough.
The strain on emergency services must be enormous. Multiple doses, more ambulances, you name it. And then you've got the logistical puzzle, how to make sure clubs, restaurants, and community centers all have naloxone on hand. It's like a widespread safety net we're rushing to string up while people are already falling.
Absolutely. And if you zero in on the hotspots like New York City's South Bronx, you find entire neighborhoods in crisis. The documentary Living with Fentanyl provided a stark look into what's happening on the ground. Overdose rates are through the roof. Families are torn apart. It's not a localized tragedy. It's become a region-wide, nationwide emergency.
The documentary pointed out that if the South Bronx was a separate state, it would rank second in overdose deaths, just behind West Virginia. That's not a small statistic. It's a testament to how deeply rooted and widespread the issue has become in that one concentrated area.
You see the community activists doing their best. They're out there passing out naloxone kits and teaching people how to recognize an overdose. But the problem is multi-layered. Addiction is partly about the neurochemical grip these drugs have on the brain, and partly about socioeconomic conditions, lack of jobs, inadequate healthcare, mental health challenges, and so on.
Right. The approach has to be comprehensive. There's law enforcement, sure, because the supply chains and distribution networks need dismantling. But you can't just throw everyone in jail and hope the problem fixes itself. You have to address the root. Why do people turn to these drugs in the first place?
Yes, it's the why that's the tough nut to crack. Many who struggle with addiction have underlying trauma, mental health issues, or chronic pain. If we don't offer viable treatments or coping strategies, it's like slapping a bandage on a wound that really needs stitches.
The data shows that about 70% to 80% of overdose deaths from January 2021 to June 2024 involved illegally manufactured fentanyls. It's a relentless wave. The West region of the country saw fentanyl-linked deaths jump from 48.5% to 66.5%. So it's no longer something that's just a regional or coastal problem. It's everywhere.
The documentary also shared staggering details of seizures by law enforcement. Something like 2,000 pounds of fentanyl powder and 2 million pills were seized, preventing 65 million potentially lethal doses from going out onto the streets. That's success on one hand, but also a horrifying glimpse into how large-scale this black market really is. That was just 1 year.
And for each big seizure, you know there's more out there. The supply keeps coming, often across borders. The question becomes, do we need more border security, more interdiction on the ground? It's like trying to use a net to catch water. If we don't reduce the demand, the supply will find its way in.
Right. Whenever there's big money to be made and a steady demand, supply tends to materialize, legally or otherwise. What Dr. Mercola hammers home is the importance of addressing the entire picture. You can do all the supply chain crackdowns, but if people are drowning in addiction, something else will pop up to fill that void.
Speaking of the entire picture, let's zoom in on how fentanyl actually kills. Opioids latch onto receptors in the brain that normally control pain and emotions. It can create euphoria, but that same mechanism depresses the respiratory system. If you stop breathing and no one's around with naloxone, there's no margin for error.
Exactly. And because fentanyl is so powerful, the margin for error is razor thin. It's not like someone has time to realize they're in trouble and call for help. In many cases, by the time they recognize the overdose, they're already losing consciousness.
Let's talk about solutions. One big recommendation is to expand access to naloxone. We've seen attempts to install it in clubs and bars. That can help in the immediate sense, saving someone's life in a crisis.
Yes, that's an important piece. But we also need robust public awareness campaigns, especially targeting those who may recreationally use other substances. People need to know the risk of accidental ingestion of fentanyl. We're living in an era where you can't be sure what's in that so-called party drug. It could contain a lethal surprise.
Then there's the question of ramping up treatment and recovery services. If you don't offer pathways out of addiction, you're just stuck in an endless cycle of emergency rescues. That's necessary, but it doesn't solve the underlying addiction.
Precisely. Dr. Mercola points out the importance of addressing the root causes. That includes mental health services, therapy, and even innovative pain management strategies. It's about giving people the tools to cope without resorting to opioids.
We sometimes think of addiction like a moral failing, but often it's more like self-medication, people dealing with pain, stress, or trauma. If there's no accessible help, the path of least resistance can be that quick chemical escape. Our job as a society should be to open up other avenues that are healthier and more sustainable.
And that's not cheap. Funding mental health programs, improving access to therapy, job training, and community support doesn't come with a small price tag. But ignoring it is more expensive. There are the healthcare costs, the strain on emergency systems, and the social costs of families losing breadwinners and loved ones.
Right? We see the ripple effect, lost productivity, children growing up in unstable environments, cycles of poverty exacerbated by addiction. The price is huge, not just in dollars and cents, but in human lives and fractured communities.
Education is huge too. When you consider youth, one of the best ways to reduce harm is to educate them early. Let them know the risks, the science behind how these substances work, and why a quick high isn't worth the potential lifetime of consequences, if you even get a lifetime.
There's also that notion of chemical coping. You have a mental health crisis in this country. People are anxious, depressed, lonely. Many turn to substances. Fentanyl, being as potent as it is, can sneak into the picture, even for folks who initially had no intention of trying an opioid.
And that's the crux. If we poured resources into mental health support, community building, educational opportunities, essentially giving people hope and a sense of purpose, we might see a reduction in drug abuse. It doesn't solve everything, but it's a meaningful step.
So let's circle back to the big question. Where does all this leave us? Clearly, we have to handle immediate crises, overdoses happening every day. But we also have to tackle the broader environment that enables this crisis to flourish.
Yes. Some steps are pretty clear. Expand naloxone access, educate the public, strengthen law enforcement against illegal suppliers, and offer real pathways for recovery. The more nuanced steps address root causes like poverty, trauma, pain, and hopelessness. It's not an overnight fix, but it's the only viable road to a long-term solution.
Dr. Mercola's perspective often includes natural health approaches. While that might sound tangential to synthetic opioids, there is a connection. If we can manage pain more effectively with approaches that don't involve heavy meds, we reduce the pipeline of potential opioid misuse.
Yes, whether it's physical therapy, DMSO, acupuncture, massage, or even lifestyle changes like diet and exercise, there are plenty of non-opioid methods to address chronic pain. But they require time, effort, and often a supportive healthcare environment. It's easier to get a prescription for pain pills than to go through months of targeted therapy. That's the sad truth of many modern healthcare systems.
So this crisis is a wake-up call that convenience isn't always best when it comes to pain management. A pill might offer quick relief, but we're seeing the cataclysmic downside. And with fentanyl, that downside is amplified to a tragic extent.
Let's not forget there's also a need for local community-based programs. Local groups often know their neighborhood's specific challenges. They might have better rapport with residents. Empowering these groups is critical, because they can tailor solutions in a way a massive federal program can't.
Community empowerment is one of those ideas that sounds warm and fuzzy, but in practice it's extremely pragmatic. People trust local leaders or neighbors more than they trust a generic public service announcement from someone in a suit. The more grassroots involvement, the better.
The documentary showcased organizations distributing naloxone and teaching residents how to use it. They're in the streets, day in and day out, forging personal connections. That's how you change culture. That's how you prevent at least some people from falling through the cracks.
Right. And we saw clubs and restaurants in New York City being supplied with overdose prevention kits. That's a sign of the times. We have to adapt to reality. Sure, in an ideal world, we wouldn't need them, but we don't live in that world.
I find it both hopeful and disheartening. Hopeful because people are proactive. Disheartening because it's necessary. But such is the messy world we inhabit. At least we're seeing some communities respond in a constructive manner.
It's quite a shift from the just say no era. Now we're more about, in case you do say yes, or you accidentally consume it, here's how to save your life. Harm reduction acknowledges human behavior rather than lecturing from an ivory tower. It might feel uncomfortable to some, but it often proves more effective than blanket condemnation.
People will always engage in risky behavior. Our job is to mitigate the harm and create off-ramps to healthier lifestyles. We might not be able to stop every single tragedy, but we can reduce the frequency.
That's a big part of Dr. Mercola's ethos too. Empower individuals with knowledge and resources. Instead of paternalistic medicine telling you what to do, it's about offering tools and understanding so you can take ownership of your health.
And part of that ownership includes recognizing the mental, emotional, and spiritual dimensions of why we do what we do. If we numb ourselves with substances, we're missing an opportunity to heal deeper wounds. That's where therapy, community, and a healthy environment come in.
Let's talk about the bigger socioeconomic angle for a moment. Poverty, unemployment, and lack of educational opportunities often cluster with higher drug use. If your environment feels devoid of hope, an opioid high might seem like a temporary escape from despair. Then you factor in fentanyl's brutal effectiveness, and it becomes a deadly cycle.
Right. It's a storm of vulnerabilities. If we want to break that storm, we can't just pass out naloxone, though that's essential. We also need to build a foundation of opportunity. Good schools, safe streets, job training programs. These are the threads that weave a safety net so people don't sink into that black hole of addiction in the first place.
It's a tall order, but that's what Dr. Mercola's work often reminds us. You can't fix a complex health crisis with a single silver bullet. It's about layered interventions, each addressing a part of the puzzle.
If you zoom out, it's almost a case study in how systemic health issues require systemic solutions. Whether it's an opioid crisis or metabolic disease from poor diet, you see the same pattern. Focusing on immediate symptoms isn't enough. You have to go upstream to find what's polluting the river.
Speaking of pollution, let's consider the conversation about how synthetic drugs get made. Fentanyl is far cheaper and easier to produce than heroin. You don't need fields of poppies. You can do it in a lab. That means the supply side can ramp up quickly, fueling the crisis. And with carfentanil, you need even smaller amounts to create thousands of lethal doses.
Which is why law enforcement is on such high alert. If you intercept one large shipment, you could be preventing hundreds of thousands of potential overdoses. But the labs often pop up overseas, and the distribution channels are very creative at smuggling. It's a cat and mouse game at a massive scale.
Meanwhile, individuals on the ground are simply seeing a flood of dangerous substances. As you said earlier, some users don't even know what they're ingesting. Others are physically and psychologically dependent. Stopping that cycle is as monumental as it sounds.
But let's highlight the positives for a moment. Naloxone is more available now than ever. Community groups have become more organized. Lawmakers in some areas are waking up to the need for comprehensive mental health services. There's a sense of urgency that could translate into meaningful reforms, provided we keep the momentum.
True, necessity has often been the mother of invention, or at least the mother of action. While we can't celebrate the crisis, we can acknowledge that it's galvanizing some of the best in our communities, health workers, volunteers, and local leaders, to step forward with creativity and compassion.
They're distributing information on how to recognize overdose symptoms. They're teaching rescue breathing techniques. They're letting people know that if they or someone they know is struggling, there are support groups and counseling available. Those small acts can literally save lives.
Another angle is the use of fentanyl testing strips. They aren't foolproof, but they let people test substances before using them, so they're aware if fentanyl is present. That's part of a harm reduction strategy. Some folks question whether it encourages drug use, but the reality is it can prevent accidental death.
Exactly. Harm reduction can be controversial. But at some point, you realize that simply telling people don't do drugs doesn't cut it, especially when the drug supply is tainted with a lethal agent. Better to give them the means to know what they're dealing with, in hopes they'll reconsider or at least be prepared.
It's a complicated conversation, but if the goal is saving lives, you have to employ every tool at your disposal. We're well past the stage of naive optimism.
The tragedy is real. Families lose loved ones, communities lose their spirit. But as with any crisis, the resilience of people can also shine. That documentary showed families turning their grief into activism, pushing for more resources, more education, and more empathy.
Grief can be a powerful motivator indeed. It sparks legislative changes and community outreach. People who've lost someone often become the most passionate advocates. It's not the kind of inspiration anyone wants, but it can bring about real change.
The discussion also reminds us that health isn't just about the body, it's about societal well-being. Dr. Mercola has always championed natural health, but natural health exists within a social context. If your environment is flooded with synthetic toxins, or if despair is your daily reality, no amount of organic kale is going to solve that.
Now, there's a mental image, trying to fend off a tidal wave of fentanyl with kale. That's comedic, but it underscores the point. Solutions must be holistic: nutrition, mental health, environmental support, community involvement, and law enforcement. These pieces must come together.
So if I could summarize, fentanyl is a massive, lethal wave hitting many parts of the country, especially New York City. Over 6,300 people died from opioid overdoses in New York State in 2022. Nearly 70% of overdose deaths nationwide involve illegally manufactured fentanyl. And those numbers keep ticking upward.
Carfentanil is an emerging threat, 100 times more potent than fentanyl. Even a minuscule amount can be fatal. This is straining emergency services because multiple doses of naloxone are sometimes needed to revive a single person.
The documentary Living with Fentanyl shows us the reality on the ground in places like the South Bronx, where overdose rates are off the charts. Meanwhile, law enforcement seizes massive quantities of fentanyl, but there's still so much out there that the crisis shows no sign of slowing.
Community organizations and city programs are fighting back. They equip bars and restaurants with overdose prevention kits, including naloxone. They provide education on recognizing overdose symptoms. They distribute testing strips. They host counseling and support groups. But the challenge is still enormous.
Ultimately, the crisis reflects deeper issues of mental health, addiction, socioeconomic struggle, and healthcare gaps. The conversation is shifting from just stop the drugs to heal the people. We need a multi-pronged approach that addresses supply, demand, and the underlying reasons people are vulnerable to addiction in the first place.
That's the heart of it. It's easy to get lost in the grim statistics, but there's also hope in how communities and advocates are stepping up. Systemic problems need systemic solutions. We might not solve it overnight, but each step forward is a potential life saved.
And that's exactly why we talk about it on Dr. Mercola's Cellular Wisdom. Because real health wisdom isn't only about the best supplement or the newest research on longevity, it's also about tackling the public health crises that affect our communities right now.
Thank you for joining us for this deep dive. We hope it sparked some new insights, or at least a fresh perspective on this urgent topic. We'll be back soon with more conversations that blend the serious with a dash of wit, and hopefully shed some light on the big health challenges we face.
Indeed, we can't promise all sunshine and roses, but we can promise an honest look at the issues, with a bit of humor sprinkled in. Stay curious, stay informed, and remember, caring for our collective well-being is part of the equation of natural health.
We appreciate you all. Until next time, this is Ethan Foster saying, take care, stay aware.
And this is Alara Sky reminding you, there's always hope and humor, even in the darkest moments. Keep shining, everyone.
Thanks for listening to Dr. Mercola's Cellular Wisdom. We'll catch you again soon.
Bye for now.